Today, I'm going to answer one of the top questions asked on the internet about fibromyalgia. And it's probably going to seem like an easy question, but it's what are the symptoms of fibromyalgia? And I'm going to answer that question from two different perspectives. The first is what you would find if you Googled the question online. So it's really from a traditional medical point of view, and it's not all wrong by any means. It is, however, incomplete. And I'm going to attempt to quickly fill in the blanks. So from a traditional perspective, fibromyalgia is a complex and chronic pain disorder characterized by widespread musculoskeletal pain, fatigue, and tenderness. Its symptoms can vary from person to person, and they often overlap with other conditions. All true, and that makes the symptoms vary from patient to patient, making diagnosis often challenging. Some common symptoms of fibromyalgia include widespread pain. The hallmark symptom is widespread pain and often constant pain that affects multiple areas of the body, including muscles, joints, and soft tissue. The pain can be described as aching, burning, stabbing, or shooting. Fatigue is another big symptom. People with fibromyalgia often experience significant fatigue even after a full night's sleep. The fatigue can interfere with daily activities and lead to decreased energy levels. Then there are tender points. These are specific tender points on the body that are more sensitive to pressure in individuals with fibromyalgia. These points are located around the joints and are often used in diagnosis. Many have sleep disturbances with fibromyalgia, difficulty falling asleep, staying asleep, or experiencing restorative sleep. There are often cognitive issues referred to as fibro fog. People with fibromyalgia might experience cognitive difficulties such as memory problems, difficulty concentrating, and mental clarity issues. There's also in some morning stiffness. People with fibromyalgia may wake up feeling stiff and achy, with these symptoms improving as the day goes on for some. Also, headaches, chronic headaches, including tension type headaches and migraines, are common among individuals with fibromyalgia. And then irritable bowel syndrome, also known as IBS. Many individuals with fibromyalgia also experience gastrointestinal symptoms such as abdominal pain, bloating, diarrhea, or constipation. And just a quick word here. I have not ever found a fibromyalgia patient that did not have gastrointestinal problems. Remember, the gut is like the hub of a wheel, and it has spokes that go to your emotions, that go to your adrenals, your thyroid, your of course your immune system. There's really no area that's not touched by your gastrointestinal function. Then there's sensitivity to stimuli. People with fibromyalgia may be more sensitive to light, noise, temperature changes, and other sensory stimuli. Anxiety and depression. Living with chronic pain and other fibromyalgia symptoms can lead to increased levels of anxiety and depression. What this explanation doesn't tell you is that everyone with fibromyalgia has variations of symptoms because they have variations of underlying causes and predispositions. So let me give you an example. I have worked with people that have been diagnosed with fibromyalgia, and upon investigation, I found that the cause of the fibromyalgia was predominantly mold toxicity, food sensitivity, yeast overgrowth, and a vitamin D, as in David, deficiency. Now, this patient's symptoms were aggravated and exacerbated by foods that they were eating, the fungal overgrowth that was inside their gastrointestinal system, and the fact that they were struggling to detoxify from mold exposure. Yet they were diagnosed with fibromyalgia. They had all the telltale symptoms. So was fibromyalgia actually the problem? Well, fibromyalgia was certainly the diagnosis that they fit into, but that told us nothing about the underlying cause of the condition. Another patient diagnosed with fibromyalgia had different underlying causes, like most women do. Each patient is an individual, so there are always variations. Now, this patient I'm referring to had been diagnosed with irritable bowel syndrome. Raynaud's, which is an autoimmune disease, Hashimoto's thyroiditis, which is another autoimmune disease. She also had yeast overgrowth and leaky gut syndrome. So after investigating, we found that her underlying causes were, as I mentioned, unique to her. Once we uncovered the hidden causes, we were able to deal with them individually and restore her health. So there were two completely different patients, two completely different causes, yet the exact same diagnosis. So if you are struggling with fibromyalgia, it is extremely important that you find a functional medicine practitioner that will help you dig into and uncover scientifically using top-notch laboratories and in-depth health history to determine your specific personal cause and triggers of fibromyalgia. If I can be of any help to you, we do work with people all across the country remotely, have a program called Fibromyalgia Heroes, where we help our patients determine the underlying causes, address those causes, and restore their health. It's important to note that these symptoms can vary in intensity and may come and go over time. If you suspect you have fibromyalgia or are experiencing these symptoms, it's essential to consult your healthcare professional, hopefully a functional medicine practitioner, for an accurate diagnosis and appropriate management. Now, remember this. In traditional medicine, generally speaking, they attempt to cover the symptoms of the disease with medications. And in some cases, it's helpful. Where emergency medicine is concerned, someone may go in with a heart attack. Well, they address emergencies and they are very, very good at it. A functional medicine practitioner only works with people that have chronic conditions. And we have become very, very good at what we do. We know the tests to run after we do a complete and thorough health history. So if you're suffering with a chronic condition, functional medicine professional is who you should look for. Guys, I hope this has been helpful. Thanks so much. God bless you and have a great day.
If you are struggling with a chronic condition and would like more information, feel free to visit www.birminghamfunctionalmedicine.com. You are also welcome to set up a phone or Zoom consultation with Dr. Dailey at www.talktodrd.com.